So now I'd like to give you some specific instructions for your facelift that's coming up, some things to know and help make the process a little bit easier. So you're gonna have the surgery, then you'll spend some time in the recovery room. Then you'll get to go home. You're gonna have a big head dressing on, and plus 2 little drains that come out back here. That night, just leave everything in place. Sleep elevated, sleep on the back of your head. For the first several weeks, no bending over, no getting your blood pressure up, no turning side to side or up or down like this. You want to turn your whole body so that you really let this cement into place. Nothing frozen on your face in any way that can kill the skin flaps, and no heat on your face. Hot things can burn you because you're numb, but they also can make you bleed. So you want to be careful with that, especially as well. So you'll leave all of that stuff in place that first night. If you had your eyes done at any point through this too, you're going to be sent home with a tube of some ointment that you'll put in your eyes at nighttime. That helps keep them moist. And then I also recommend you pick up before surgery something called Refresh Gel. It's an oily type substance that you can put in your eyes as much as you want. It helps your eyes feel better. So that's a good thing to do as well. Then the next day, you usually see me that day after, at the latest 2 days afterwards. We'll check on you. We're going to take everything off, take the drains out, and we'll put a lighter dressing on for 2 more days. At that third post-operative day, you're going to take all of that off and you're going to shower. You're going to wash your hair, soap and water, all that stuff's fine. Blood is like old dry blood's going to come out. It's going to look kind of crazy. That's totally normal. A little hair's going to come out. That's normal as well, so don't worry about that. And then you can fix your hair and everything should be okay from that standpoint. A little moisturizer on your face is fine at that point too if you'd like to. You'll have some stuff that the medical assistant is going to give you with some products that you'll want to use as well. So be aware of that. You'll get that as part of everything as well. And then at day 5, you'll see, roughly day 5 or 6-ish, you'll see us and we'll have your first set of sutures out. And then at day 10, your final sutures come out. And that may be day 10 or day 12, somewhere in that range, but everything else will come out at that point. Usually people look good enough by 2 weeks to run errands, 4 weeks, and you're pretty much social event ready. All those restrictions kind of stay for 6 weeks, so I really don't want you stretching or turning anything. That's what you really paid for, so don't stretch it out. Let that really solidify in with some good scar tissue at first, and that will help your long-lasting results. You'll have some medications. You'll have pain medicine and nausea medicine. If we do some fat grafting or laser, you'll also have an antibiotic. And if we do the laser, you'll also have acyclovir, which is to help with those cold sores. The laser can bring that out. You'll actually start that. That's the only one you start the day before surgery and then continue for 4 days after surgery. So that's the only one. Everything else is for after surgery. So hopefully that kind of helps with the process. We'll let you know with things as we go along. But if you have any questions before then, give us a call, and I look forward to seeing you for surgery.